Okay, so today we have some really amazing stuff to talk about. You've had a really interesting week with some of the consultations and patients that have been coming into the office. You sent out a really impactful message through our online community and body site that got a ton of responses and feedback. And so today we're going to dive in and dig into more of the concepts behind that message and dig a little bit deeper into that. So let's start walking through some of that.
Sure. I think a common theme that continues to come up is pain and grief and trauma. And it's really important to really start talking about these things because pain and grief and trauma are not just in our conscious thought, right? It's not just in our emotion, it's actually in our bodies,
Mm-hmm.
right? It is a sensation in our bodies. So when we talk about healing pathways and healing modalities and some things really being at the core of why someone is experiencing not just emotional pain but sometimes not recognizing emotional pain, not recognizing emotion, but coming in with very somatic um, responses in their body that lives in their body. So I wanted to talk about how those things actually don't just live in our mind, but they actually live in our nervous system, in our cells, in our muscle fibers, in our joints. It just goes so deep.
Yeah, we definitely see this show up a lot of different ways, and so um, sometimes essentially what we're talking about is people's stress, um, their grief, their just emotional, I don't want to say baggage, but emotional past,
Yes,
how that starts to show up in their bodies physically,
right, how
right?
it lives in their body.
And kind of what we're starting out talking about, and we jumped right to it, was that can show up physically, right, as pain
Yes,
in our joints and a lot of different
yes,
muscle tension,
right.
um,
Fibromyalgia.
fibromyalgia, but it can also show up in other ways in our body,
That's right.
um, hormones, and that's kind of where I think you see a lot more of that with our red light program, and a lot of the work that you're doing nutritionally with people is how that those issues show up as patterns, and also as they show up as um, people being stuck in not being able to lose weight. Um, their hormones are being super impacted. Um, that's a lot of the conversation that you've had this week.
It has been.
Is has been
Yes.
not so much how that emotional um, traumas have showed up physically as far as pain, but physically as far as feeling stuck or
Feeling stuck.
being stuck and not being able to reach their health goals.
So the body can take on the brunt of pain. The body can take on the brunt of grief. I've had so many conversations in this week alone, which I think it's so interesting because it really needed to be talked about, right? It really
Mhm.
was actually showing up for us, and it really needs to be addressed because I'll have someone, you know, um, sit with me for some time, and you know, we'll talk through things, and they'll just I always ask, like, well, in the last year I've gained 70 pounds, and I'll say, wow, so, in the last year, so what's taken place in the last year, right? And in this week alone, I heard things like,
People crack open then, right?
they crack open, and they'll express, like, I had a death in the family. I'm going through a divorce. I'm having a midlife crisis. Like, I'm having some identity problems, and all of a sudden I just look at them and I say, you know what? Like, grief has a biochemical rhythm. Like, this pain has a biochemical rhythm, and I let them know, like, this is not on you, right? This is definitely a response of being in a state of survival, right? Where there's, like you said, a lot of hormones are going to upregulate, especially, like, your body's going to start adrenaline dumping, and you have taught me that your body doesn't necessarily have a neurological unhooking to release the hold, the brace, right? That it's just going to keep running on that rhythm, and what happens is that signal shuts down almost every other system in the body. That signal is going to shut down digestion, because all we need to do is survive right now. We need to survive, breathe in and out, put one foot in front of the other. So every other system, as far as our body is concerned, really, doesn't need the attention that our survival does. So that means immune system gets suppressed. We wonder where, like, all the autoimmunity comes from when we're dealing with grief and pain and trauma. Well, all of these things get suppressed, and so it really is just like a perfect storm.
Yeah, so what you were referring to is the work that we've done some other podcasts and episodes on trigenics, but it's essentially, if I injure my shoulder, my brain locks down and clamps down certain muscles, other muscles it completely turns off, and that just turns into basically a pattern which leads to pain, inflammation, wear and tear, and big issues. And
all because the body's trying to protect itself.
It's trying to protect itself. And it gets stuck and locked into that model until you basically get the brain to go back, look at that issue, and recognize, almost hit Control-Alt-Delete on it,
right,
to reboot the system so that your brain is looking at that in a healthy way again.
That's so good.
Same exact things can happen emotionally when you have this crazy emotional event happen in your life, which is going to happen to everyone. Your body gets in this state of reaction to that.
That's right.
And unless we understand how to go in and address that from a couple different ways.
That's right.
So, so unless we go in and address that, your body's going to hold on to that.
That's exactly.
Now, some of it is absolutely processing it verbally.
Absolutely.
And mentally.
That's right.
And there's a mental and component to that.
That's right.
But I think that there's also a physiological, and what we're talking about also is a response that happens in the body that we need to go in and let the body know it's safe to let go of that response.
That's right.
Because we can sit, from a grief perspective, we can talk through with someone that, yes, someone in my family recently passed away. Mm-hmm. And we can go through a grieving process with
That's
that.
Right.
And
an understanding of the grieving process, the origin of the grieving process.
I can mentally understand
That's
they're no
right.
longer here right now, but my body is completely registering something different.
That's right. Trauma
And
is nonverbal. Trauma is nonverbal. It lives inside the sensation in
yep.
the body.
And as a society, we suck at grief.
We suck at emotions.
We suck at emotions. I will be the first to I I was 40 years old before I really started like trying to understand what emotions am I even feeling? Like, and we'll spend some time on that some other time, but yes, we suck at grief, we suck at emotions. If someone that we know is had an event that they're grieving, we are, as a society, are not taught or trained well to help people, right? Like, well,
Oh,
they're in a better
but
place.
oh,
It's like all of the things that we can tell people can logically be true, but mentally, emotionally, physically, we suck at helping people on those planes and levels
right.
process trauma, grief,
That's right.
life events that are making an impact on us.
A huge impact. And you had talked about the brain before, so I definitely want to come back around to that because I will never forget. I had an incredible therapist. First, I just want to acknowledge that this subject is so very near and dear to my heart and is so much about what my life's work on this earth is for this thing right here, is for knowing that I know it because I know that I know. So I remember a therapist describing that, okay, so trauma and PTSD is like gravy on the brain, and really started to break it down in this way. And then when I got it, and this was the logical part, right, that I really got it, and then understanding, once I understood what it was in the brain and then how it had moved, through the body and then needed to be moved out of the body, which is, we're going to talk about the miracle and the gift of healing and reclaiming embodiment and safety and joy and all of those things. There is so much more for you beyond this. I can tell you that. As long as you are willing to be brave enough to show up to it and move through the work, it is for you. But just like you said, you need all of those components. You need the cerebral processing of it, but then you need to recognize that there needs to be a lot of release work and somatic work to be done through the body as well. And we're going to talk about the B.E.S.T technique because I want to share a couple of experiences of releasing actual trauma, stored trauma, cellular trauma, just from using that technique, because it's pretty incredible. But that's one of the somatic pieces. Red light therapy is also a somatic piece of actually doing the release work of cellular energy. The whole nature of it is to liberate toxicity from the system. Brain, which is interesting. Yes.
So explain that gravy
On the
analogy.
brain. So trauma and grief can rewire the brain in this way. So your fear center, which is the amygdala, is that how
amygdala?
Thank you, amygdala. That comes from Star Wars, I'm sure.
Yeah, amygdala is
Amygdala.
fear.
Is that the fear center? Okay,
Mhm.
fear center becomes overactive, right? Prefrontal cortex becomes underactive, and is it the hippocampus?
Hippocampus.
Okay, which is is that memory, right? Memory and memory integration. Actually, that shrinks. Yes. So when we say gravy on the, that's the best way to describe it, gravy on the brain, meaning that, it's hard to grab your words, let alone figure out what you're feeling, right? Which we should talk about the wheel. Like, yeah, that thing, everyone should have that wheel. Everybody needs that emotion wheel. I've needed that emotion wheel, right? To really.
So what she's referring to is when I talk about describing like me, doing some work to do a better job at understanding this is what I feel.
Yes.
Like in general, but like also in this moment, like
yes.
to try to get a better understanding. Like I would sit down to journal and I printed out this emotion wheel. So I could just go through this wheel and say, okay, I'm feeling this. I feel this. I feel this.
Yes.
And just to be able to begin to recognize, put emotions with what I feel like I'm feeling.
Yes.
Which, again, I feel like a 5-year-old, but that's sometimes I feel like that's what was my emotional intelligence was like I only had the vocabulary of a 5-year-old to describe how I was feeling emotionally. And
oh my gosh, that's such a great example actually of that. How many of us are like frustrated and we don't know why we're frustrated, but we could totally throw a temper tantrum if we wanted to. No wonder, because they just don't have the articulation of the expression of being able to.
I didn't have the vocabulary
yeah.
Not even vocabulary, but awareness
yeah.
of that. So
wow.
So yes, the with the traumas and a lot of times we don't even register some of these things as grief,
right,
or trauma,
right,
or we've been kind of, again, as a society, trained to, well, what I'm feeling is not as bad as this person.
This person has it so much worse.
This person had a way worse childhood. This person had
right.
An abusive marriage.
Right.
And so, or they lost a child.
Right.
Right? I lost a parent. I lost an animal, a pet. Right? But
we minimize it.
We minimize it
So
ridiculously.
on a subatomic level.
And we just keep going.
Swallow it and push it and stuff it down our throat.
Yep.
Yeah.
And but that, kind of getting back to it.
Yes.
That shows up.
It does.
In our brains, and what you're saying is it's like gravy, in that it just kind of mushes everything.
That's right. So now emotional numbness. We're disconnected from ourselves. We're disconnected from our bodies. Like, it is a form of disassociation, actually, and that can feel like, when we talk about disembodiment, it really is a feeling like you're floating around out there somewhere. Like it's describing it as like I'm not even in my own body right now, and sometimes I'll sit with our patients and I'll be like, "Are you in your body? Are you in your body right now?" And it's a huge epiphany to be like, oh wow, like I'm not even in my body. So it can also show up as anxiety, right? It can show up as depression. And here's another one, not just disconnection from myself, disconnection in any relationship, like not being able to be fully present, like in the moment, but being disconnected. That's another one that we've talked about recently.
Well, and this also shows up then as patterns of I'm feeling something under the surface emotionally and mentally.
That's right.
And what my body starts to do to address that is emotionally eat.
Self-soothing.
Self-soothing, right? Like we come up with all these coping mechanisms. I work really hard. I
Oh.
I binge watch Netflix to just be somewhere
That's
else.
right.
I drink too much, eat too much, right? Like we're trying to soothe grief and traumas and a lot of our emotional and mental problems, um, and then that shows up physically in those ways.
Yes. And I think the also if you lean into your body, and the more you do this work, the more you recognize it. But how about the reverse of that, which is like I'm not feeling or acknowledging any emotion, but I'm definitely experiencing sensations in my body, right?
Mm.
Like such as like right like anxiety has a
Mm.
has a very like somatic,
Sure.
right, like, and visceral,
Shortness of breath, digestive
heart
issues.
palpitations, like all of that stuff.
Mm-hmm.
Yeah. So yeah.
And you know, like you said, you've seen this show up a lot of different ways this week. Um, so, what are the most common ways that you're seeing a lot of our patients recently, this sort of thing showing up? And what I love is, we're going through a rebrand right now. So we're changing our name from Westerville Chiropractic and Nutrition to Atlas Rising. We're going to be talking about this a lot, but this whole concept speaks to the entire name change of um, kind of what we're trying to convey with that.
That's
And so what are you most seeing this show up with our patients who are coming in for red light therapy? Let's just take that for example. Like this week, you've seen a couple like really amazing stories of this topic showing up with people for red light. Um, how physically is it showing up for them?
right. um, so I will say once we unscrew that release valve, right? um, it's incredible, right? We're so first of all, we are talking, finally, like feeling safe enough, and safety is, I will tell you, safety is really important, but feeling safe enough and finding someone that's safe enough to share, you know, those really intimate moments of life with, and being able to finally, right? Because now it's no longer here on lockdown, right? Now it's out here. Ah, what a relief, right? So now that it's out here, it's like, okay, great, like, and usually I just am like, you know what, God, like, you see all of this, like, what do you want to do with it? Well, the answer is always like, let's heal it. Like, let's heal this thing, right? So once we get all the modalities going, now we're safe enough to share our experience with another human being, because we were actually created for connection and not isolation. That is really important. It's really easy to think that you can do the healing work isolated. You cannot do the healing work isolated. It takes a huge village to do that. So being able to share that experience, honor that experience, understanding that it's not just right in my head and my heart. It's time to move things out and through the body, right? In red light, I see it a lot, because I almost let people know, I'm like, what you're about to experience is your body finally letting go. We're finally releasing. And it's interesting because I remember turning to someone this week, and she had lost a grandson, and it's just such an honor to be able to sit with people, and again, work through that. But it becomes evident. I'm like, you've been carrying him around for 2 years. And being able to do the letting go and the releasing without and knowing that you're not going to lose your connection to that, love in your life. Like it's just really important work. But when you get under those lights, like that releasing and that letting go, like it's just bound to happen. So being able to closely walk with someone in their letting go and releasing process actually translates in the body. Like you can see it. Like grief, like takes on its own physical form. Trauma takes on physical, like you can see it. Not only can you see it like in the body, like you see it on the countenance of people's faces, like when they finally start to reclaim like their joy, to work through how to hold on to the love that can never be lost. I just want to say that love like that is never lost. Never.
Yeah, and grieving something does not mean forgetting.
Oh, so
like
good.
You can grieve someone or an experience, and that doesn't mean you forgive it or you forget it or you just ignore it,
right,
or you pretend they weren't here or that didn't happen.
Yes.
That's again, I think that's part of the misconceptions about what grief is. But yes, there's ways to process those emotions and heal the body at the same time.
At the same time,
and
knowing
you need to do both.
You need to do both. And some of that work is in understanding, like, their existence changed, but it didn't end. So it just opens up that whole, like, you know what I'm saying? It just opens love back up, and then love can come in. I've had, women lose their husbands, and I say lose. They didn't lose. We don't lose those people. They die, right? They die, they transform, they transmute. Like I said, the existence changes, but it doesn't end. So being able to allow that life and that life force to live on through them in a really constructive way of helping release and let go and move forward, not on. I hate that so much. I tell people, you know what? The truth is that you're never going to move on. Like it doesn't get better. Like you get used to it, and it changes. It just changes.
Mm-hmm.
So, but what a beautiful thing to see when people realize, like, they actually can release that right over, because it just does. Like there's a residency that was in their body that is no longer taking up residency anymore, and it makes more room for their joy and their love and their peace and embodiment.
And what I love about the programs and the work that we do in the office is we're not therapists, we're not counselors, but we have lived enough life to be able to have conversations with people and recognize and help them understand how these events are showing up inside their bodies.
That's right.
Because most of the time they're coming to us because they don't feel at home in their bodies, they don't recognize their bodies any longer, or there's a lot of pain or inflammation and ailments or dis-ease in their bodies, and they want help with that, and we have to address these other things as well.
Absolutely.
Otherwise, we're putting a Band-Aid on a symptom that's of something that's an underlying cause of what's happening and going on.
Yes.
And so I love that we can have, part of, I think one of the biggest parts of the benefit of our red light program are these conversations, are the access that people have through Body Sight to communicate and talk with you, the community that that we have for people to be able to go through this process. It is not just eat these things, get on the lights. Like, that's the least of it.
Yes.
It's the transformation that happens inside themselves that actually lets the results of those things
That's right.
manifest.
That's right. So they can live fully.
Yes.
Fully.
And that be a lasting change.
That's right.
Right? Because most people's biggest concern when they start coming in is this all going to come back again?
Right.
And I don't want to lose 30 pounds and then it just all come right back. I think for a lot of people, unless you're addressing some of these other issues and why this is going on in the first place, I think that's why other programs aren't as successful. It's because they're not addressing the people side of it.
Right.
It's not just a do XYZ and everything's great. Like,
Right.
you have to address the person too.
Right.
And from a more pain and physical perspective, I think that's where over the last year I've really started looking at trigenics, which is the kind of the neuromuscular part of it, and then also B.E.S.T, which stands for bioenergetic synchronization technique. And I got tuned into that from back when I was young. The chiropractor I had seen was a very amazing B.E.S.T practitioner. He integrated that into his practice. And so over the last year, I've begun studying this a little bit more. So I don't know if you want to share your experience with that.
So we talk about body-centered healing modalities, right? That we need to move things through body-centered healing modalities. And I can share that my body was having some really intense physical reactions, right? The whole thing, right? When we say anxiety doesn't even begin to touch what I now know is a panic attack, and really being in that place of like, there's really not knowing the difference between am I having a panic attack and being convinced that I'm actually dying, right? Because you have all of the symptoms, like just all of it, right? To where it's like, you've got chest pain and, the pulse is out of control and you like shortness of breath and what's crazy, emotions on lockdown and just feeling paralyzed, right? Just all of the things. And I had been vulnerable enough to come into the office and say, I
Something's not right.
Something's not right, and I'm trying to figure out right now if I'm going to the emergency room or what it is that I need to do.
Mm-hmm.
And then you just, you said, okay, let's go ahead and get on the table. And, we took my blood pressure first.
We checked to make sure you shouldn't be going to the
hospital.
emergency
Let's
room.
right,
Yes.
exactly.
Yeah, for sure.
Blood pressure, pulse, all of the things. And you'll just have to explain what happened from there because I don't know how many minutes in and explain the technique a little bit, but I wasn't but a few minutes in, and then very involuntarily I mean, we call it like sobbing, wailing, like from a place I haven't known before. Um, and when it all cleared, my body came back down to a state of peace, safety. My heart rate came down. All of the weird sensations I was feeling all stopped.
Yeah, so it's a technique that aims to balance the different parts of the nervous system. So you've got your sympathetic and parasympathetic parts of the nervous system, and there's certain points you can touch on the body using different polarities. I'm trying to explain this in a very condensed way, but essentially trying to get your body tuned into there's imbalances in these nervous systems, and so the body needs to go in and look at these, and then it normalizes them.
The body needs to go in and look at these.
Absolutely. And there's certain emotions that we can almost ask the body what is showing up. And then I'll have people think of these emotions, and again, it's getting your brain and your body to reprogram and reprocess some of these things without knowing anything about the specific event that happened, because it doesn't necessarily matter. If you're going through therapy, you need to address that event and understand it. But the physical side of it, the body doesn't need to understand it. It just needs to go in and correct and relook at how that emotion is showing up physically. I had a very similar, I got turned into this technique almost identically. I was in college, woke up in the middle of the night, I thought I was having a heart attack or something. I did go to the emergency room, no problems. A couple days later, still having the issues, went to see my chiropractor. He did this B.E.S.T technique on me instantly. Corrected it. So that's what opened me up to, okay, there's no, in my experience, there's no denying how mentally and emotionally things show up physically.
Exactly. And sometimes, and you talked about, I didn't know what event was actually still living in my body. And I have been in 7 years of deep, wound work and healing work and things like that. And it just came up out of nowhere. So to be able to give my body the gift of saying, okay, this is something we need to look at, and we need balance brought back to this space. There's, again, you cannot deny an experience like that. There's no denying.
So we could probably talk for hours about this.
Absolutely.
From our own experiences, from patient experiences. But I think the biggest, from this week and the conversations that we've had with patients, the messaging that we've sent out and the responses that we've gotten, I think our biggest takeaways are, first of all, recognizing that there might be an underlying reason why things are showing up. Physically, in our bodies, immune-wise, and all kinds of ways. And so just being aware of that and asking a little bit deeper question of, okay, I've been experiencing these problems for a long time. is there anything that I need to address inside that? I think secondary to that is, you know, make sure you're finding people who are who are open to having these conversations and at least acknowledging that that's a component, right? Like, just numbing it and with prescriptions or, all the ways that we described earlier, like, is not a solution to actually resolve what's happening. And lastly, I think the concept that we talked about where you do need to address it from in multiple ways. You should address things physically. You should address things verbally and mentally. You should address things spiritually and emotionally.
That's
And
right.
like, you have to address these problems and experiences in a lot of, in multiple ways. Um, just as much as you shouldn't just talk about the problems. Like, there's a physical side of it. There's also not just the physical side of it. Like, we don't recommend people come in and just get red light therapy or just get some of these techniques that we can do physically and not address the emotional component as well. So it is a balanced approach, but that's the direction that we've recognized, we appreciate from our own experiences, and we're really striving towards helping people connect on those planes. So we love it. Super exciting, very rewarding. Um, so if you feel like this is you're having troubles physically that you think might be emotional problems, or you just don't even know where to begin to look emotionally, grab the feeling wheel. But but we're here for that. So if we can support you in any way, we're happy to do that. Certainly, if it's something more significant, we're gonna point you in the direction of some other professionals who we know and trust that can also. So we want to be a resource center for people who are dealing with all kinds of different life happenings. So until next time, we're here for you. Reach out, drop some comments below if you have any questions or if we can do anything to serve you. Thanks.